like this, you set goals, you set priorities. When you were last on the program in the summer, the first thing we talked about was the president's #1 priority, and he laid it out last June.
What I've said is our top priority has to be to control costs. And I've said very clearly, if any bill arrives from Congress that is not controlling costs, that's not a bill I can support. It's going to have to control costs.
And yet, Democrats I've talked to, Republicans for sure, outside experts have said, frankly, this bill fails to adequately control costs. Warren Buffett, the billionaire investor, somebody that the president said he would listen to, spoke about the fact that it fails to really tackle costs adequately in the healthcare system. He spoke on CNBC this week. Listen to this.
I would say that one way or another, we're going to attack cost, just like they talk about jobs in the economy. It's cost on this side. That's a tough job. I would try to get a unified effort, say this is a national emergency to do something about this. We need the Republicans, we need the Democrats. We're going to cut off all the kinds of things like the 800,000 special people in Florida, or the Cornhusker kickback, as they called it, or the Louisiana Purchase. And we're going to get rid of the nonsense. We're just going to focus on costs, and we're not going to dream up 2,000 pages of other things.
Why not focus at this point with the outcome uncertain and say, you know, we're just going to do a bill that focuses on reducing costs, and then we'll come back to the idea of expanding access at a point later on when it's more politically feasible?
Well, I think we definitely learned a lesson from what happened in Massachusetts, from the bill that former Governor Romney signed into law, where they pushed access but didn't deal with costs at the same time. And so it's why the president has been insistent from the outset that this deal with costs. Every cost-cutting idea that every health economist has brought to the table is in this bill. Massive changes in the delivery system, ways to discourage the kind of Cadillac insurance plans being offered into the future, a fairness in terms of who's paying for healthcare costs, less spending in the Medicare system for things that we know don't add to people's health outcomes, but we're over-subsidizing insurance companies, really aggressively going after fraud and abuse, which is why the president directed the Attorney General and me to, you know, put together strike task forces. Additional ideas are in there. Every idea is on the table.
You don't deal with tort reform, which the president has talked about more recently.
Actually, we do deal with tort reform. That's just not true. He moved ahead on tort reform early on, directing me to
pilot
put
programs
money
is
out.
what he supported.
Well, but states are in various stages.
Right.
Many states, like my own state of Kansas, have already passed full tort reform. Others haven't at all. This is really a state-level situation.
But whether
where
it comes
to
to
the best ideas
malpractice reform, whether it comes to subsidizing volume, whether it comes to, you know, salaries for doctors and so forth, do you really assert you disagree with Warren Buffett that this adequately bends the cost curve?
Well, according to the nonpartisan accounting Congressional Budget Office, they say we get over $100 billion in deficit saving the first 10 years, and that ramps up as you look in the outer years to $1 trillion. I think that's real cost cutting. I think that's real change in that deficit.
But where are the cultural changes to how expensive end-of-life care is, or how many tests are ordered by doctors, or the administrative costs, be them in hospitals or insurance companies?
That's all in there. It's all in there. There's a huge amount of administrative simplification, getting to that 30 cents of every dollar that's not paid, paying benefits, but currently has docs filling out a gazillion forms and has insurance companies providing billing over and over again. We've got huge delivery system changes so that you no longer would pay hospitals if 1 out of every 5 patients gets readmitted in 30 days. You pay for bundled care, which is a coordination between docs and hospitals, pay for medical homes, follow-up care. We know that not only are those good for patients, but they're hugely cost-effective. They're in the best healthcare systems in America, and that's the direction this bill goes, and it pays for health and wellness for the first time, preventive care.
But Secretary Sebelius, even experts, people who run the Cleveland Clinic or the Mayo Clinic, who have really been on the vanguard of reducing costs, they say there's only the potential for some of these things to pay off in terms of getting away from subsidizing volume. So how can you assert with such certainty that this bill measures up to the president's goal of bending that cost curve, of bringing health care costs down?
Well, one of the things that we do, again, is change the insurance rules on the private sector. That will lower costs for families, lower costs for businesses. Everybody says that just having a new insurance marketplace, getting rid of the cherry picking, allowing insurance companies to go back and forth, not only streamlines administrative costs, but lowers costs overall. And we run two of the major public health systems, changing the way Medicare pays for medical care, that we pay for quality and not any longer by the number of tests you do, will help also drive the private market. We've got every strategy, every idea that health economists, that experts say works is in this bill, including a lot of measures, David, which the Congressional Budget Office doesn't count for. They say maybe health IT, the use of electronic health records pays off. We know it does. It's in the system. They don't give credit for that. We know that investing in health and wellness works. If you have fewer diabetics in 10 years, if you have fewer people who smoke, if you have fewer overweight and obese Americans, that's going to lower health costs. No credit is given to that. So we get right now $1 trillion over 2 decades in health savings without even giving credit to a number of the programs.
I want to go to just a couple of more issues. One has to do with how this gets paid for, and that is a tax, an excise tax on these so-called gold-plated or Cadillac plans. But in the Senate bill, that's been put off until 2018. And the reasonable question comes up, which is, do you really think a future Congress, which will be under a lot of pressure not to raise $1 trillion worth of taxes, is going to withstand that pressure? Or are you going to be left where, because this Congress won't raise the tax now, they're going to put it off to 2018. So you're going to have all the spending and not get any of the savings until 2018? Isn't that unrealistic?
Well, I think two things happen right away with the way this is designed. First of all, it puts insurance companies who pay the tax ultimately on notice that this is coming, and they can begin to change the kind of policies that are in the marketplace. What we want to do is change insurance company behavior, which hasn't been very strategic in terms of cutting costs. And in fact, as the Goldman analyst said, they are driving up costs. They have a market strategy that they're willing to dump customers and continue to raise costs. So changing their behavior, putting them on notice that this is coming. If a future Congress decided that this wasn't a good idea, the way the rules work, they have to come up with billions of dollars in substitute payment. This is subject to the PAYGO bill. They don't just get to cancel it and march down the road. So I think it is a good balance between getting a very effective cost strategy as part of this legislation and putting people on notice so that their policies don't change overnight. This isn't imposed overnight, but they know it's coming, and we've got to change the structure.